basal cell carcinoma or an enlarged oil gland. Both have blood vessels. One is irregular, which is basal cell carcinoma, and an enlarged oil gland, which has regular blood vessel. Both of them are shiny and waxy in appearance and texture. Both of them can be pink, especially basal cell carcinoma. But what I'm seeing here are globules of yellow material, and it's also indurated in the middle. So that spot has a classic clinical characteristic of an oil gland. It's an enlarged oil gland, or what we call it sebaceous hyperplasia. There's document on office visit morphology: non-inflamed, confluent, yellow, globulal or globular papule with regular blood vessel. Diagnosis: sebaceous hyperplasia. So that's good news. Not a skin cancer. Very good news. What causes these things? Sometimes these things are genetics, but it's mostly they become bigger through direct influence by our hormones, specifically testosterone, and that gets converted to what we call dihydrotestosterone. They enlarge. When they enlarge, they also create more oil production. That's why some patients, when they have a lot of oil glands or oil activities, they develop blackheads and whiteheads. But good news for you, I only see one spot so far. Do you mind if I take a look around all your face? Is that okay? Okay. Take a look at your cheek here. Good. Got some freckles here, but none of them are concerning. Tip up your nose. Malar chance of scarring is very minimal. I could definitely get it done for you aggressively, but the chance of darkening or hyperpigmentation scarring is high, but a rather slow and steady, small at a time, small increments. So we'll hyfrecate today or we'll cauterize today. Have you come back in about a month? If it's still there, and if you're happy with the results, and if there's improvement, we can cauterize again. What do you think? Yes? Okay, great. Pain scale. This cautery machine range from 0 to 32. I'm just gonna do a 1 level, so it's gonna stings just a little bit. You'll be fine. You'll be fine. I promise. I'll take care of you. Okay. So let me put on my gloves here. Are you allergic to any medications? No? Okay. This is not latex, this is nitrile gloves. Okay. So, how long have you lived in this area? Whoa, long time. It's a beautiful area. I love coming here. And it's beautiful in the summer too. Yeah, I traveled to 5 places, and I have to say this is my favorite spot or favorite area that I like to work in. You are lucky. I wish I could move here, but I can't afford here. Yeah, but I'm here, and I'm happy to take care of you. Yes. Okay, so before we hyfrecate, I'm just gonna clean this area with alcohol swab. Okay. Okay, I'm just gonna wipe it here. Okay. Okay, circular motion. That's it. Okay. Just gonna dab with alcohol right there. Alright. Okay. Alright, are you ready? Okay, I'm just gonna test here and see if it works. Okay. Alright. So it stings a little bit. It's almost like you're frying an egg on a pan and some of those oil splatters on your skin. That's kind of how it feels. Okay. Burn. Okay, how's that? Not too bad, right? Burn. Okay. Alright. You okay to do one more? Okay. Okay, great job. Great job. Okay. How's it feel? Not too bad, right? You did good. You did very good. Okay, game plan. Starting tonight. Vaseline. That's all you need to do. After you wash your face, moisturize first. What kind of moisturizer do you use? Yeah, CeraVe, yes. That's my favorite too. I recommend that a lot, so that's awesome. What about cleanser? What kind of cleanser are you using? CeraVe, wow. You should just do my job. That's awesome. Great. Okay, so after you moisturize, all you need to do is dab it with a little Vaseline, which I'm gonna do that for you right now. Okay. see my next patient. Have a good night. Bye bye. Take care.